The odds are not in my favor.
Jessica Bailey's kidneys are failing. She needs a transplant desperately, but doesn't know when she'll get one. She had one booked last September, but the Saskatchewan Health Authority canceled it, reassigning staff to bolster ICUs flooded by COVID-19 infections. New numbers, obtained through a Freedom of Information request, show how deadly that slowdown may have been. In November, the SHA said it delayed roughly 26,000 surgeries between March 2020 and October 2021. Government data shows 479 surgeries were canceled in that period because the patients waiting for procedures died. That's 100 more than before the pandemic.
That's a pretty harsh number when it comes to only a few months for somebody like me who's on the other end of it.
Around 60% of the patients who died before and during the pandemic were waiting for cataract or hip or knee replacements, but the number of those who weren't still increased. A healthcare consultant says they succumbed because of the slowdown.
There's absolutely no doubt that some of those approximately 100 additional deaths were caused by a delay in surgery.
Dr. Dennis Kendall stresses multiple factors can lead to deaths, and these numbers need nuance. But it is clear the increase shows people died during the pandemic from things other than COVID. He also says gathering restrictions sooner would have helped reduce these numbers. NDP leader Ryan Miley says the government could have prevented it.
The Premier took the summer off, ignored modeling that showed that we were about to face a deadly Delta wave, and removed every public health measure that he could. And as a result, we saw the worst fourth wave in the entire country.
Global News asked the government about the backlog and restrictions. A spokesperson didn't address the deaths, saying surgeries started resuming normal levels in November. They included a link to the government's plan to increase ICU capacity and use private surgery clinics. Bailey is in close contact with transplant staff and says things just started moving again, though she still doesn't know when she'll get surgery. She says gathering restrictions would help hospitals and that operations need to happen sooner because she can't wait long.
The action needs to happen sooner than later because I'm at my bitter end here.
Nathaniel Dove, Global News.